Dr. Gaby Moawad is a highly esteemed, award-winning obstetrician-gynecologist who's been using VCare for over 10 years. CONMED met with Dr. Moawad to learn more about his experience with VCare and to share his insights with others. Why do you like and use VCare?
For me, it's the most important thing with minimally invasive surgery that a lot of people do not take advantage of is the VCare, or the manipulator, helps you have an additional arm to expose the tissues, to enable you to do more complex tasks at ease. So it's very, very important, and I keep telling my fellows or my resident, the most important role is the person who's using the VCare, because they can expose for the surgeon a lot of the areas where they can do more surgery at ease.
Were you using any of the competitive versions before VCare?
No, I like usually to try different things just for a trial, because I believe every single instrument, as simple as the manipulator, have a learning curve, and I like to try different things to see what fits my practice. And then I've never found anything like VCare.
What are the most important VCare features to you and why?
I think for me, the S-curve is the most important feature of VCare, because it enables the movement, a higher range of motion, rather than completely an arced or even a straight manipulator, because with that you can get a better retroversion. If you have a low pubic bone, you can have a full range of motion doing that. For patients who are obese, that helps you a lot by doing that rotation or twisting movements to expose a lot of the areas. So I think by far the S-curve is the most valuable thing for me, at least for me.
What advantages does VCare offer over other uterine manipulators on the market?
It's very sturdy, so I believe a lot of the manipulators do not provide the strength. Many times they could bend. Again, I choose VCare not because of any of those features except the S-curve.
Did you see any improvements in OR efficiency, patient safety, or cost when switching to VCare?
I think the manipulator is a tool. It's really hard to prove efficiency with a manipulator. I can tell you, using no manipulator or using a manipulator that have suboptimal range of motion, the surgeon's going to struggle. So eventually, on the long run, definitely it improves efficiency, and the efficiency comes also from the extremely short learning curve for the novice user of VCare. But on patient outcome, I don't think it has to do anything.
In your opinion, what's the most effective way to manipulate with VCare?
The traditional theories of retroverted uterus, well, people think if they elevate their hand, this is the uterus retroverted, while with VCare you can twist it and you have an extreme retroversion, especially in hysterectomy or doing an anterior myomectomy. That's going to help you a lot. And again, one other feature is the twisting of the VCare, because VCare is very resistant to twisting. So when you twist on it, you can put a lot of tissue under tension on the contralateral side.
Do you have any tips or tricks to share?
The surgeons needs to be in constant communication with the assistant during these procedures, because what happens is most of the time the assistant needs that direction to show. So pushing on the manipulator sometimes is not necessary if you're working on the more distal portion of the uterus. Pushing when working on around the vaginal cuff to separate, lateralize more the ureter is more important. Pushing during a myomectomy is not necessary, because it's going to bring tissue closer to the surgeon camera, and it's going to make it more challenging. So I believe a constant communication with an assistant who knows how to use the tool is going to enable more efficiency and going to make the surgeon's life, in a sense, very optimal during the surgery.
Do you recommend VCare to other surgeons? If so, why?
I do travel a lot and proctor a lot of physicians, and then every time I ask them, do you have a VCare in your OR? I think you should try it. This is amazing, because I can see sometimes with poor uterine manipulators or poor uterine manipulation how hard an fairly easy, simple case will become for a surgeon. It will be more complex or more challenging for the surgeon.